Hi guys, welcome back. We shall talk about rabies virus now. And before I start off this rabies virus, I would like to tell you it is a very fatal disease. And if you have rabies infection in you, that is in human beings, you are almost 100% going to die. There are very less people in this entire world who have survived rabies, and that too survive, it's barely surviving. Okay, so now this rabies vaccine, rabies virus is caused by a virus infection to a mammal, and that mammal is actually biting human beings. So what is this virus? This virus is known as rhabdovirus. Okay, rhabdovirus. This virus infects mammals, specifically warm-blooded animals, and they infect their nervous system. Now, if this animal comes in contact with human beings and it bites you, it scratches you, you are going to have this rabies virus. Okay, so this is the infection of the nervous system of the animal, and that animal itself is having rabies infection, and that animal is coming and biting you. So this is known as rabies transmission, right? So this transmission, we never want this to happen. So what is going to happen whenever this animals, what animals I'm referring to? These animals will be dog, cat, your monkey, your your fox, your bat. So monkey and fox are very more common. Okay, and this rabies infection, rabies virus infection is actually seen more in children less than 15 years, because they are not very well aware, or even if they get a bite, even if they get a scratch, they do not tell their elders. Okay, they do not take the specific precautions. So that is the reason we see a larger number of people infected with rabies in the age group of 15 or less, and it's more seen in developing countries or underdeveloped countries, right? So this is about rabies. So what happens whenever an animal is going to bite you? That the virus is actually present in the saliva of the animal. So whenever it bites you onto your arm, into your leg, into your body, anywhere, this is slowly going to replicate in the site area. That is, it's going to replicate in the muscle. Then slowly it is going to the peripheral nerves of your body. From peripheral nerve, it's going to go to your spinal cord. From spinal cord, it will ascend up. Now it will ascend up and it will go and reach to your brain, and from brain it can come to your cornea, it can go to major organs. So that's the entire course of the rabies infection. So you don't want actually this to happen, because you have it and you're 99.9% or almost 100% that you are going to die. There is no treatment of rabies. Okay, there's only prevention of rabies. There is no treatment of rabies as of now. So what are the clinical features? The clinical feature, what I want to say, that you should not rely on the clinical features, because once you develop the clinical feature, you're almost dead. You're going to die for sure. Okay, now this clinical feature will not come before 9 days. Okay, this is not going to come before 9 days, and the incubation period is from, let's say, from few days to few weeks to few months. It is around 4 to 8 weeks, but it can extend up to many months. So what is an incubation period? Incubation period means if you have a virus, if you have infection, if you have a disease in your body, it will take some time to show the clinical features, the signs and symptoms. This is known as the incubation period, right? So if I get a bite from a rabid animal, it will take me around 4 to 8 weeks to show the symptoms. So what are the symptoms that I'm going to develop? The symptoms can be very dangerous and very bad to hear. The person will be very thirsty, but you will not be able to drink water, because you will be developing a condition known as hydrophobia. Now this hydrophobia means whenever you see water, your inspiratory muscles and your diaphragm will contract suddenly. Okay, it will contract suddenly and you won't be able to drink water, yet you will be thirsty. Now also you'll be having fever, you will be very anxious. At the same time, you will be having some maniac disorders. That means you might be having some mental disorders. You might go mad. You might be having drooling of saliva from your mouth. And you might even go and want to bite someone. You will be spitting at other people. So this is what is going to happen in a human being. So that's a very dangerous thing that we see, right? So what is the treatment now, right? This is a clinical feature. As I told you, you should not rely on clinical features. The clinical feature, the only thing that they should rely on the history of a bite, okay? History of bite of a rabid animal or of a animal. So you cannot say which is a rabies animal. Is he infected, himself infected or not? You cannot say that, but you cannot take a chance. So you have to take the treatment, okay? So now what is the treatment? Before I start off the treatment, you should understand any bite of an animal is divided into 3 types, okay, in this rabies category. Type 1, type 2, type 3 category. Type 1 category means an animal is coming and licking your intact skin, okay? You are touching the animal, you are giving food to the animal. So in this thing there is no problem, okay? So you don't need to take any treatment for this. Mind you, I'm saying intact skin, okay? Category 2, in this the dog or the animal is coming in scratching you, okay? You have some sort of mild blood coming out, and you will be, and he or she, the dog or the animal, is coming and licking you on broken skin. Now what do I mean a broken skin? Maybe a cut, previous scar, maybe a lesion, right? So this is the thing that is known as or you might be having any dermatitis, any broken. In short, what I mean to say is that there is any break in the continuity of the skin, or there is direct contact with your mucous membrane, your mouth. You might be having a bleeding gum, you might be having an ulcer in the mouth, or it directly comes and touches your eyes. Any mucous membrane, you are having the chance, that is referred as category 2. Right? In category 2, the treatment is to give rabies vaccine. We are giving rabies vaccine. We are giving intramuscularly 1 ml of rabies vaccine. Right? In category 3, we are having deep bite, okay? Deep bite which involves bleeding, that is the blood is coming out from the wound, that is literally dripping out. It's involving of biting, right? So deep muscle penetration. In this we are actually treating by 2 technique. We are giving rabies vaccine, along with that we are giving rabies immunoglobulins, because whenever you give a rabies vaccine, it will take some time for our body to actually produce the immunoglobulins. But when we are talking about category 3, that is a deep cut, deep bite, we don't have enough time for our body to make rabies immunoglobulin. So we are giving rabies vaccine, along with that we are giving rabies immunoglobulins. Now this immunoglobulins is given on a dose of 20 international unit per body weight, per body kg body weight. So now this dose is divided into 2 parts. Half is given at the bite site and half is given intramuscularly. Along with that, you have been given rabies vaccine, right? So this is category 1, category 2 and category 3. Category 2, you need rabies vaccine only. Category 3, you need rabies vaccine along with rabies immunoglobulin, right? So this is the treatment. So what is the first step that you can do at your home? The moment the dog or the animal bites you, the first and the foremost thing is that you immediately rush to your sink and wash the wound properly. Wash it with running tap water and soap. Apply the soap, make a lather, make bubbles. Try to penetrate inside your wound if it is a flapping wound, right? So you have to actually clean it very properly. You have to, you need to even rub your soap over your wound. It might burn, it might have a burning sensation, but you have to do it. And you have to put your wound under tap water for at least 15 to 20 minutes. At least 15 to 20 minutes is mandatory, okay? Do it as fast as possible. But in some circumstances, if you say that you are getting late, maybe after 2 or 3 hours, still you have to do it. Soap, water, you have to apply soap and then go to the hospital as fast as possible. Now this vaccine and immunoglobulins are effective only if it is taken within 1 to 2 days before the after the bite, okay? If you take on the 3rd day, it's not going to work. Still we give it, but it's not going to be effective, okay? We don't take a chance, but still give it. The effective is that you should take it as fast as possible. 1 to 2 days maximum. Do not delay it more than that, okay? So that's the about the vaccine. And in a hospital also, they are going to, in the emergency room, they are going to clean the wound with normal saline or anything. They are going to irrigate the wound. They are going to use soap, and then they are going to clean the wound. After that, If there is any necrose material, that means if the material of the muscle of the skin has been damaged, they're going to throw out, and they are not going to apply any kind of suture. Suturing is not done, because if you suture the area, that area will be devoid of oxygen, and then it might actually help the organism to grow, right? So suturing is never done. You always clean the wound like 15 to 20 minutes with soap and water. And please remember, there is no treatment if you develop the symptoms. So you always do the treatment prior to the symptoms development, okay? And rabies is a very, very, very fatal disease, and if you develop the symptoms, you are most likely to die. In fact, this is the most fatal communicable disease, okay? This is the most fatal communicable disease, rabies infection. Again, I tell you, these animals, warm-blooded animals, especially cat, dog, bat, fox, monkey, these animals, if they bite you, if they scratch you, if they lick you, you should be very, very careful. At home, wash the wound with soap and water and go to the hospital as fast as possible. Incubation period can vary. Do not wait for the incubation period. Do not watch out for the clinical symptoms. If you're really waiting for the clinical features, symptoms, you're almost going to die. So the vaccine and the immunoglobulins are safest. Immunoglobulins are given half onto your bite side and half to your intramuscular area, given at a dose of 20 international unit per kg body weight. And rabies vaccine is given 1 ml intramuscularly. So we have a date, we give in day 0, day 3, day 7, we give it day 14, day 30 and day 90. This is the pattern. Yes, in some country it might vary a bit, but mostly this is the thing, right? So this thing will be very well, vaccination and the immunoglobulins will be very well done by your doctor. You are not supposed to do it, right? Any dosing or any medicine dose or any medicine drug of choice or treatment plan that I tell you in this video or any upcoming videos are just for general understanding. Please do not take this as a final treatment. You need to go to your doctor and meet in person. In video or in phone, it is very difficult and there are chances of complications. So this is a very big disclaimer that I want to make. You may even die, you may have some complication, that is drug may do some adverse reaction. So please do not take medication reading on a newspaper, reading on an internet source, or listening to someone or some video. You have to go and meet your healthcare professional, okay, face to face. That's the thing, because all the drugs sometimes is going to work in one person, is not going to work in another person, right? So this is a disclaimer that I want to tell you. So rabies, again I tell you, be careful about this rabies. Do not take it lightly. Children's, be very, very careful. And also we have some protocols of that. If a person is frequently coming in contact with animals, then they can take pre-prophylactic doses, okay? They can take pre-prophylactic doses to reduce the chances of rabies infection, right? So immunoglobulins, rabies vaccine, and cleaning the wound very properly with soap and running tap water, and not suturing the wound. So this is the things that you should watch out. Category 1, category 2, category 3. Category 1 will not require any treatment unless there is lick or any lick on the intact skin, okay? There should not be any broken skin. Category 2, lick or scratches on the broken skin or mucous membrane. Category 3, deep bites, okay? So this is what about rabies that I wanted to say, and that's all for now. Thank you.